Hi, the purpose of this video is to explain carpal tunnel syndrome, surgical and non-surgical treatment options, risks, and potential benefits. I will also answer some of the common questions asked about endoscopic carpal tunnel release by the many patients who I have treated over the years. There is additional information about this and other hand and arm conditions we treat on our website at floridahandcenter.com. Carpal tunnel syndrome results from pressure on a nerve in the wrist area, the median nerve. The patients develop this problem for unclear reasons, and no effective treatments to prevent this are available. The commonly held notion that you have to engage in some sort of highly repetitive activity to get carpal tunnel has been clearly shown to be false. Although it is seen more commonly with other conditions like arthritis or diabetes, many patients have no clear risk factors. The symptoms range from annoying to disabling, and without treatment will usually progress. This can lead to permanent nerve damage, but is generally preventable with timely diagnosis and the right treatment. Non-surgical treatments are often attempted for carpal tunnel, but are not consistently effective. These include vitamins, anti-inflammatory medicines, braces, injections, chiropractic, etc. This inconsistency has been verified by a number of prominent independent third parties. Many of you viewing this video will have had some non-surgical treatment, but it is not a requirement before deciding surgery is the best course. The wait-and-see approach has also been shown over and over again to be one fraught with the risk of allowing permanent nerve damage to occur. When these patients are told how easy it could have been to avoid this, they are deeply disappointed. Unfortunately, there are no obvious signs of permanent nerve damage, and how long you have had carpal tunnel and how severe you experience the symptoms have not been found to reliably predict nerve damage. For example, I have seen patients report 1 month of symptoms that have severe nerve damage, while other patients with years of symptoms see immediate and complete relief of their carpal tunnel with treatment. The lesson here is to get a skilled evaluation of your symptoms and then get treated. Carpal tunnel surgery involves cutting a ligament in the palm of your hand that then relieves pressure on the nerve. There are 2 basic surgical methods, open and endoscopic. With open carpal tunnel surgery, there is a 4 to 6 inch incision in the palm. It will reliably relieve carpal tunnel syndrome, but it sometimes is accompanied by pain in the palm, stitches, the need for pain medication, as well as having a significant recovery period. Most surgeons use this technique because they have not been trained in the endoscopic approach. Endoscopic carpal tunnel surgery is a minimally invasive technique that accomplishes the same thing, only with the use of a very small incision away from the palm area in one of the creases of the wrist. This technique is not new. In fact, it was developed more than 20 years ago. As technology has advanced, the technique has been refined and made even less invasive. I am one of the country's leading surgeons for this procedure, and I am #1 in the state of Florida according to their data. In my hands, this has become, in many patients' description, the easiest surgical procedure they have ever had. The surgery is performed in an ambulatory surgical center or as an outpatient at the hospital. You are given sedation through an IV, much like that for an endoscopy or colonoscopy. Some people refer to this as twilight. There is no need for general anesthesia or a breathing tube. Once sleepy, I will then inject your hand with a long-acting local anesthetic so you will wake up with no pain. The less than ½ inch incision is closed with medical superglue and a very light bandage is applied. The procedure takes less than 5 minutes and you are in the recovery room and on your way home very quickly. I have performed this procedure on thousands of patients, from those in their 20s to those in their 90s. Like any medical procedure, there are no guarantees and there are some risks. These risks include infection, tendon, artery, or nerve damage, and poor healing. Fortunately, these risks are very uncommon, with more than 95% of patients very satisfied with the procedure. After surgery, you are able to use the hand for light tasks immediately. This is not a procedure that incapacitates you. We will ask you to be gentle with your hand for a couple of weeks after surgery, but most of your daily activities will be minimally affected. My nursing staff will check with you about a week after the procedure, but feel free to call us anytime with concerns. Relax. I take this and any procedure very seriously and will do everything I can to assure you have an easy experience and a quick recovery.